There are 71 new community cases to report today, now being seen across many parts of Auckland. This takes our total cases in this outbreak to 1,790, of which 1,189 cases have now recovered. Today's new case numbers are sobering, but not unexpected because of where we are in the outbreak. As we see numbers increase, it is even more important that people get tested if they feel unwell and get vaccinated if they're not already. Testing and vaccinations remain our best tools for fighting the virus. Please also wear masks when you're out and about and wash your hands often. A reminder that at Alert Level 3, travel is restricted and only allowed in your local areas for permitted reasons, which include going to work if you need to, shopping for food, and getting exercise. The key thing is for separate families not to be mixing indoors. Of today's 71 community cases, 32 are yet to be linked to a current case, but interviews with these cases are being carried out today. Of these, 25 interviews have been delegated to public health units outside the Auckland region to help manage the workload on the Auckland Regional Public Health Service. Of yesterday's 55 cases, 21 cases remain unlinked at this point, with investigations also ongoing. There are 33 people in hospital with COVID-19. 5 of those are in ICU or a high dependency ward. All are in hospitals in Auckland, with the exception of 1 case in Palmerston North Hospital. On testing, yesterday there were 13,960 swabs taken in Auckland and 28,646 tests processed throughout the country. There are 20 testing centres open in Auckland today, including 14 pop-up centres. And please see the Health Point website for the locations. Just an update on Waikato. There are no new cases to report in Waikato today. The 2 cases reported yesterday remain unlinked, but some potential connections have been identified and investigations continue. Whole genome sequencing from samples is expected later today, and that will also help determine any links. There continues to be a great response from the people of Waikato, with 3,680 swabs taken yesterday and 6,327 vaccinations given. Please keep up the great work. An update on Northland. There also continues to be a great response in Northland, with 2,145 swabs taken yesterday. There are no positive cases in Northland. There were 3,464 vaccinations given, and we can report that 54% of Māori in Northland have now had their first dose, and there have been more than 200,000 vaccinations given throughout the region. Just an update back to Waikato. There has been a positive detect in wastewater from Te Awamutu that was taken. That was a sample that was taken on Tuesday. Follow-up samples have been taken, and we're awaiting the results of those. The Waikato District Health Board public health staff are investigating whether this represents a new case or an old case who may be shedding the virus, and we've had these situations before. But in the meantime, anyone in Te Awamutu who has COVID-19 symptoms or has visited a location of interest should get tested immediately. A pop-up testing site will be available at the Te Awamutu Event Centre car park from 2 o'clock today until 5 o'clock. COVID-19 was also detected in a wastewater sample from Raglan on Tuesday. This does follow earlier detections from samples taken last week. Again, we have had a number of cases in Raglan, but a reminder, anyone in Raglan with symptoms or who's been at a location of interest at the relevant time to get tested. I'm pleased to report there's been no COVID-19 detected in Palmerston North. There were some detections last week, but again, we had a known case who was in Palmerston North.
As you can see from today's case numbers, we are continuing to see a growth in cases in Auckland, while containing cases in Northland and the Waikato. We had expected and indeed have been foreshadowing that case numbers in Auckland would rise, but they are climbing more quickly. We are continuing to act on public health advice. Every day we discuss the cases and the numbers with public health teams on the ground in Auckland and in the Ministry of Health. Their advice has not changed. We can actively control this outbreak at alert level 3. From the analysis undertaken by our public health teams both on the ground and at the Ministry of Health, we can see that very few of the cases we are seeing are the result of transmission in workplaces. Where they are coming from is still within households, some in our health settings, and a large number in gatherings taking place inside people's homes. We did see this happening in alert level 4 as well, and sadly it has continued into alert level 3. These gatherings inside people's homes are not allowed under alert level 3 as much as they were not allowed under alert level 4. My message today is clear. We need people in Auckland to stick to the alert level 3 rules. As the Director of Public Health has just said, this outbreak is not in a small number of clusters in a small geographical area. It is affecting people in all parts of Auckland, which makes it everyone's job in Auckland to help prevent its spread. New Zealand's alert level 3 is amongst the toughest set of restrictions applied by any country in the world. The Oxford Stringency Index places New Zealand as the country with the highest level of restrictions anywhere in the OECD at the moment. Level 3 has worked to contain outbreaks in Auckland before, but with Delta we know we are facing a more tricky and challenging opponent. And we also know that the longer restrictions are applied, the more fatigue creeps in and our guard can slip. But I can't urge people enough that now is not the time for complacency. I have two very specific asks for people, particularly in Auckland. Firstly, please get vaccinated. The first dose number in Auckland is around 87%, but it hasn't budged much over that in the last few days. Second doses sit at 66% and are increasing, but we need to see both these numbers over 90% to really make a difference to cases and really ensure that our hospitalisation rate stays low. Secondly, we need people to follow the rules. Stay in your bubble. Wear a mask. Maintain physical distancing. And don't mingle with family and friends other than in safe outdoor settings where we know the virus spread is limited. As I say, level 3 is the highest level of restrictions currently applied anywhere in the OECD. They can work to limit case growth, but only if everyone follows the rules. I'm conscious that the longer the restrictions that go on, the harder it is to maintain our defences. But it has never been more important to follow the basic rules we have applied since the start of last year when COVID first arrived in New Zealand. Treat those around you as if they may have COVID. Limit contact with others and maintain physical distance. Wear a mask whenever you go out of the house. Use the contact tracer app wherever you go. Wash your hands regularly and get vaccinated. It is the best tool we have to protect ourselves from the virus and to eventually move down our alert levels. And if you are vaccinated and know someone who isn't, please reach out to them. Have that conversation about why you got vaccinated and what it would mean to you if they got vaccinated too. Nearly every country in the world has faced a Delta outbreak. New Zealand continues to outperform others with the lowest hospitalisation and death rates in the OECD. As the Prime Minister said on Monday, we are at a very difficult phase of dealing with COVID as we transition to keeping New Zealanders safe through vaccination and other public health measures. But we should not lose sight of the fact our health response remains world-leading, and that as vaccination rates increase, we will get to the other side of this outbreak without the carnage that other countries have experienced. We just need to stick to the tried and true measures that have worked for us before while we reach those higher levels of vaccination. And finally, on Super Saturday, we're seeing a range of fantastic events being planned across the country. One that particularly caught my eye was the Air New Zealand are turning one of their Boeing 787 Dreamliner aircrafts into a vaccination clinic at Auckland Airport. Aucklanders will be able to board this Jabberseat flight to receive their vaccination and enjoy Air New Zealand's top-class customer service and hospitality. You can get a behind-the-scenes glimpse of an aircraft hangar, a tour of Business Premier, enjoy free in-flight snacks and receive a special boarding pass to commemorate the moment. Meanwhile, down in the South Island, I want to acknowledge the Canterbury Rugby Union, who are running a Vaccinate with a Mate initiative for rugby fans. It's giving away 1,000 double passes for this weekend's clash against Hawke's Bay for fans who are looking to get vaccinated. Tickets are also being given to the first 300 people who receive their jab each day at the Christchurch Arena drive-through vaccination clinic on Thursday, Friday and Saturday. And a reminder that you can tune in on the day to the Vaxathon, which will be broadcast on multiple platforms, including TV3 and multi-television from midday to 8 p.m. For those of us old enough to remember the telethons of the 70s, 80s and 90s, well-known celebrities, influencers and health professionals will be live, crossing to Covid-19 vaccination sites to capture the atmosphere and experiences of those receiving their first or second vaccine. We do need your help to make Super Saturday a success. Pop along to the events that are going along near you and help and encourage whānau and friends and others to do the same for our community. You can find out more information about Super Saturday, including where to get your vaccination, on the Unite Against COVID Super Saturday webpage or by calling the vaccination helpline 0800 282 926. And just a reminder for those watching that for tomorrow and the weekend there will be no 1pm media conference, rather the normal 1pm media statement from the Ministry of Health.